Good evening. It's my pleasure to talk to you tonight about the Affordable Care Act and do that in a short period of time. The Affordable Care Act is the law of the land. After nearly 100 years of failed national reform efforts, the Affordable Care Act was signed by President Obama on March 23, 2010. The need for reform is related to three factors, access, cost, and quality. Significant problems in each of these domains led to calls for a national policy response. We are quite polarized in our country as to the scope and importance of these problems and what the right response is. This graph shows cost increases in premiums from 1999 to 2009. 2011 numbers are now available. During this time, workers' contributions increased 168%, employers 160%. The costs are not just borne by individuals, they're also borne by our country. The U.S. spends more per capita on health care than most other countries, and as a percentage of our GDP, healthcare expenditures are the greatest. Another focus is addressing the issue of access. The majority of under 65 Americans have employer-based coverage. Close to 20% receive coverage through public programs, primarily Medicaid, and slightly less are uninsured. But keep in mind that not all workers have access to employer-sponsored care. The number of uninsured continues to grow. Recent growth can be attributed to the slow economy and the erosion of employer-sponsored care. I'd like to dispel one myth. The majority of uninsured Americans come from a home where there is a working adult. What's the issue? They work in low-wage jobs, blue-collar jobs, or with small firms or in the service industry. Does health insurance matter? Yes, it matters. It affects access to care and economic well-being. Over 1/2 of uninsured Americans have no access to regular health care and therefore delay or forego needed care. Uninsured people are 3 times more likely to be unable to pay for basic necessities, non-medical necessities. They're more likely to be hospitalized for avoidable problems and forego preventative care. Uninsured cancer patients are diagnosed later. This chart looks at the issue of quality and cost, that equation of value. Let's look at Japan, where the average life expectancy is over 81 years, and the per capita cost is around $2,500. Oh boy, I'm getting behind. The Affordable Care Act has 4 major categories of provisions. There are insurance reforms, which are most major. There is expansion of who and what is covered, the second most major, and then reforms in payment and how health care is delivered. This is a timeline of changes. The provisions of the Affordable Care Act will be implemented incrementally over a 10-year period. At the 6-month anniversary, we had the implementation of several insurance changes. In 2013, we're going to see some changes in how Medicaid is paid for, and the big thing is the individual mandate in 2014. There are 4 ways that a law's provisions could be prevented from being implemented. The whole law could be repealed. You could repeal or block key provisions, modify key provisions, and withhold funding. And indeed, we have seen all 4 of these in play. About 2/3 of Americans have an unfavorable view of the individual mandate, which is one of the most controversial provisions. The reasons for the unfavorable: government overreach, insurance is too expensive, and the big one, it's viewed to be unconstitutional. Okay, so let's look at different groups. The first group is those with employer health care coverage. That's the majority of under 65. Really, it's been said you can keep what you have. If you like it, keep it. The major changes here are the changes in insurance provisions that I've already talked about. In Medicare, you get to keep all your guaranteed benefits, and there's been some additions, particularly around preventative care and wellness benefits and looking at the prescription drug benefit. If we look next at Medicaid, Medicaid is where we're going to see the greatest change. In Tennessee, we will see about 650,000 Tennesseans that currently don't have coverage are slated to have it in 2014 because of the individual mandate. About 300,000 of these will get coverage because of Medicaid expansion. Now, who's going to pay for this? That's the biggest question. Actually, for 5 years, the feds pick up over 95% of the cost. The uninsured are those that are going to see the most changes, and those changes will come into effect in 2014 with the individual mandate. Uninsured individuals that aren't getting care through Medicaid will go through insurance exchanges, as will many of those insured through small businesses. Insurance exchanges are basically competitive online marketplaces for the purchase of health care. The idea being the transparency, the competition, and the economies of scale will help to control cost. Now, the public remains very split on the Affordable Care Act. Here we see that there has been a slight uptick in the favorable, and this generally is due to the independent voters' views about the Affordable Care Act. But it's been actually relatively constant since the law was enacted. Now we see a tremendous partisan gap, and probably what's most important about this gap is Republicans oppose the Affordable Care Act more strongly than Democrats support it. And so we have this real polarity between the two major groups. And what I want to do is thank you for your time, and it's very hard to talk about the Affordable Care Act in this short amount of time. Thank you.